We have an incredibly complicated healthcare system in the United States. We have hundreds of payers of the system: private insurance, Medicare, Medicaid, and many others. We have an incredibly complicated delivery system with doctors and hospitals and home healthcare agencies and dialysis facilities. That complication creates serious problems. Problems of access, cost, quality, and malpractice. We're going to talk about the cost problem today. In 2013, the United States spent $2.97 trillion on healthcare. Not many people understand how big that number is. To get a grasp, we go to France. For 66 million people, the French spend $2.58 trillion on everything. All that great French food, those great French wines, the vacations on the French Riviera, those crummy Peugeot and Citroën cars. The French spent $2.58 trillion. They're the fifth largest economy in the world. That means the American healthcare system is the fifth largest economy in the world. And it's been growing. In the early 1960s, healthcare consumed about 6% of the total economy, one of every $20. Today, it's about 18% of the economy, or one of every $6. And the reason that it's grown so much is that over those 50 years, healthcare spending has grown faster than the economy for almost every single year, except for two brief periods, one in the mid-1990s and one more recently. When you grow faster than the economy, you actually end up spending more and more on healthcare. One consequence of that is the fact that premiums for health insurance have dramatically increased over time. In 2013, the average family premium was over $16,000, and the average individual premium was almost $6,000. Those premiums have also grown substantially. Since 1999, health insurance premiums have grown 182%, whereas the economy only grew 40%. That is a huge increase in healthcare spending. That increase in healthcare spending has also produced a very large increase in the spending by the federal government for Medicare, Medicaid, the VA, the Department of Defense, the Indian Healthcare Services, and others. Way back in the early 60s, about $2 or $3 billion was being spent by the federal government on health-related items. Last year, it was almost $1 trillion being spent by the federal government on health care, and that's about the size of the South Korean economy. As a consequence, the proportion of the federal budget that's being spent on healthcare-related items has gone up to almost 1/3 of the total budget, 1 out of every $3 of the federal government going to healthcare. This slide compares how much the United States spends on healthcare with most developed countries. I often say this is the most important slide in health policy. On the x-axis is how rich a country is. That's GDP per person. And on the y-axis is how much a country spends on healthcare per person. And you can see most of the countries in Europe are in developed countries, including Australia and New Zealand, are clustered around that straight line. But as you get richer, you actually spend a little above the line. The United States is not on that line. If that line represents planet Earth, the United States is somewhere in mid-space. We're actually about $700 or $800 billion off that line. We spend 18% of our economy on healthcare, and most of those countries in Europe and other developed countries spend about 10 to 12% of their economy on healthcare. We're never really going to get down to that line, but we can decrease that difference. Why are we spending so much on healthcare? Well, some people will say, well, we have a lot more old people. Aging hasn't really over time contributed that much to the increase in spending. In the next few decades, as the baby boomers retire, it will contribute to spending. Income growth. As the previous slide showed, the richer a country gets, the more they tend to spend on healthcare, and that does drive up spending a little bit. Insurance-induced demand, or what we talked about early on as moral hazard. When people get insurance, the price they see of healthcare services is actually lower than it really is, and they tend, because it's a low price, to demand more. Healthcare prices and productivity. it turns out that the sheer prices of items, the prices we pay to doctors, the prices for drugs and devices have been going up faster than the rest of the economy. Another reason is administrative costs. We have a terribly complex system, hundreds of payers, lots of paperwork. Actually, to pay a bill in healthcare costs about $7.50. You might contrast that with how much it costs Visa and MasterCard to pay your credit card bill, which is about 2 cents. That difference in administrative costs accounts for about $40 billion a year in excess administrative spending. A lot of people think malpractice and defensive medicine adds a lot to healthcare spending. It turns out studies of this don't show that it adds anything to the rise in healthcare spending. The big driver of rises in healthcare spending is medical technology. New drugs, new tests, new surgical procedures, those things add about half of the rise in spending. That is a lot, and if you want to control costs, we have to use that technology more wisely. Next, we're going to look at where we're spending all those healthcare dollars in terms of which patients get services and what kinds of services they get.